I've shot a lot of videos on Bell's palsy and types of nerve damage and nerve paralysis. This is sort of an update in 2024, late 2024, we're in September right now, of what I do currently to manage different types of Bell's palsy and facial paralysis. One pearl, if you don't know about it, is if you do have Bell's palsy, which is basically an idiopathic type of nerve damage, which in other words, idiopathic means we don't know what causes it, although we do think it's probably an autoimmune related issue, is to look at what's called intravenous immunoglobulins, or IVIG. It's something that a colleague of mine is actually publishing right now, and I've been able to use it to help patients who are acutely having a Bell's palsy. So if you're within 3 days, maybe 4 days, you should really look at getting this. Unfortunately, most insurance companies will not cover it right now because it's still experimental, but I have seen good results in even my patients that have had this, and I would recommend it to people out there, even though I know it's something that is still on the side of experimental. It can actually reverse the nerve damage. So intravenous immunoglobulins, IVIG, really needs to be done within 3 to 4 days, ideally within 3 days of the onset of Bell's palsy, to help correct this situation. But most of the patients coming to me are way beyond the 3-day period. They're usually 5 years out, 2 years out, 10 years out, 30 years out, and they're having nerve-related loss in terms of functionality. So what do you do in that situation? There are actually several things that I do to treat it. The classical method is to actually paralyze the good side. So in other words, if this side is paralytic and it's weaker, you want to block a portion of the good side so that the two sides look in balance. In general, that's an every 3 to 4 month treatment, although over time, as that muscle starts to weaken, you may be able to get longer and longer lasting results, but not significantly so. And that is my classic standard way of managing balancing a face. There's another component which is called synkinesis. S-Y-N, Greek for together, kinesis, movement. And so when you smile, your lip may move, or when you blink your eye, your lip may move, or when you smile, your eye may blink. And that's classic an issue. So what I try to do is there are synkinesis points that I create a separation between the eye and the lip, so that when you blink, the mouth doesn't move as much. I'm injecting what's called a buccinator, and there's a synkinesis point that I release to help create better balance. And so that's something else that people complain of, as well as spasms. So I've got different ways to manage that secondary condition that is different from just managing the balancing I told you about. So in this case, the synkinesis occurs on the affected side, or the paralytic side. I'm actually injecting the paralytic side to manage the separation of synkinesis issues. The third condition is something I invented. It's in process of patent pending. I've gotten some amazing results where I can actually rehabilitate the facial nerve. Can I do it in 100% of cases? No. Can I make it normal in 100% of cases? No. But I found that if I treat it over time, that nerve gets stronger and stronger, and that result can last longer and longer. In fact, I was able to get a gentleman, 47 years old, who was born with a paralysis of his lower lip from forceps delivery, and get his nerve functioning almost normal, in fact normal, but it just needs to be retreated to create more sustainability. The sustainability I cannot guarantee, but over time it should start to last longer and work better. And here's the weird thing, is this treatment I've invented actually creates an instant health to the nerve, where you can actually feel the nerve healthier. I know that sounds a weird thing to say. Less tension, you can actually feel the movement, you can actually start to see movement in that area, in an area that you may not have had movement in 20 years. Again, this is something I've invented, no one else in the world does. I can actually combine all 3 treatments in one day. I can just do one, I can do 2 of the 3, and that's part of the consultation process of describing how I manage Bell's palsy, different types of nerve damage. Now, if a nerve has been actually cut, like let's say during a surgery where I've cut it for, someone's cut it for a tumor or something like that, then the odds of rehabilitation of that nerve are going to be far less. You need to have a damaged nerve, not a severed nerve, to work on this third aspect of nerve regeneration. So hopefully this video on Bell's palsy, as well as nerve rehabilitation, nerve balancing, is helpful for you if you suffer from this condition.